Good afternoon and welcome to today's webinar entitled Demystifying Data Collection. Today's webinar is part of the Administration for Native Americans webinar series. As you may already know, ANA is housed under the Administration for Children and Families, or ACF. ANA supports Native American communities by providing financial assistance and capacity building, gathering and sharing data, and advocating for improved policies within Health and Human Services and across the federal government.
Because of the broad spectrum of A&E projects, it's difficult to provide specific evaluation guidance. As we always say in our trainings, there are as many ways to evaluate your project as there are projects. On the screen, you will see terms that should be familiar to you as an A&E applicant and/or grantee. These elements and criteria are important to your application as they measure the impact your project will have on your community. Our intention for this webinar is to provide background and examples of evaluation because as TA providers, we see many applications that are lacking in this important criterion. We have asked an evaluation resource person, Melina Salvador, to present on her findings resulting from rigorous evaluation projects within Native communities. Her experience is more extensive than what is required for an ANA project, but it will provide a plethora of information on evaluation practices, as well as benefits and capacity building possibilities for your community. So whether you're looking for new ways to track your impact indicators or proposing evidence-based research for your project, we're sure you'll find the following presentation very educational. And again, while it's difficult to capture this topic in one webinar, remember your regional technical assistance providers are available to discuss options and offer guidance. So with that, let me introduce our presenter. This is Melina Salvador. She has an MA in Latin American Studies from the University of New Mexico, and she has more than 10 years experience planning, implementing, and researching and evaluating mental health, substance abuse, and early childhood programs. Ms. Salvador specializes in community-engaged research and has worked most prominently with Latino and American Indian communities. She has worked extensively on supporting the use, adaptation, and evaluation of evidence-based programs in underserved communities throughout New Mexico and the Bay Area. Ms. Salvador served as program evaluator for 2 home visiting initiatives funded by the Maternal, Infant, and Early Childhood Home Visiting Program, and has recently joined JBA's Tribal Home Visiting Evaluation Institute to provide technical assistance to tribes and tribal organizations funded through Tribal MHB. Ms. Salvador served as an evaluator on 2 Tribal MHB programs in Cohort 1. This experience provides her with a unique understanding of planning and implementing performance measurements strategies in tribal home visiting programs. She focuses on planning, implementation, and evaluation of home visiting programs, and specifically in the use of data for continuous quality improvement, benchmark tracking, and rigorous evaluations. So, welcome, Melina. I'm going to switch over the controls to you.
Hi, everybody. It's such a delight to be here on this phone call with you guys, or on this webinar. I will give you a little bit of a disclaimer. I tend to get a little loopy when I'm presenting, and not having you all in the audience won't give me any feedback about whether I'm funny or not, so you might have to bear with me a little bit on my jokes, but I'll just assume you're laughing. Thank you, Dawn, for that introduction. I'm going to be speaking today from this perspective of currently being a TA provider focused almost exclusively on supporting data collection in the Tribal MHB awardees, but also with this perspective of having been really in exactly the same shoes that many of you are in, looking at applying for grants or responding to grants that we've already written with extensive or pretty fundamental kind of data requirements, and trying to figure out the perfect kind of spot to put our program in terms of being responsive to those requirements and being able to do things that are practical on the ground and meaningful. So I hope today that we can go through a lot of different ideas. I hope you all feel really comfortable in this interface. I know webinars are tough asking questions, and I just want to make the information that I share as useful to you as possible. So feel free to engage and interrupt as you can. Okay. So I'm not sure, many of you may have these programs in your community, or you may already be familiar in another way, but the initiative that I'm going to be discussing today is the Tribal Maternal Infant and Early Childhood Home Visiting Program. We refer to it as Tribal MICHV. So I'm going to quickly go over that. Then I'm going to talk to you a little bit about the Tribal Home Visiting Evaluation Institute, which we call TEI. That's the institute of different organizations that support the Tribal MICHV grantees in their data collection and evaluation efforts. I'm going to talk a little bit about how we structure that. And then we're going to move into thinking about what we can learn from Tribal MICHV grantees about from the last almost 3+ years of experience that they've had planning data collection, collecting data, and then using the data. So we're going to talk about what's worked, what's been challenging, how the grantees are using their data right now, and how grantees continue to engage their communities in the data collection effort. And then we'll just end on some kind of lessons learned or implications for other programs that serve tribal communities around data collection. So the Tribal the Tribal Maternal, Infant, and Early Childhood Home Visiting Program, Tribal MICHV, is administered by ACF in cooperation with HRSA. It's funded through the Affordable Care Act, and there are currently 25 cooperative agreements awarded to tribes, tribal consortia, tribal organizations, and urban Indian organizations. One of the really early lessons that I learned as an evaluator on these programs is that there's a real distinct difference between a grant and a cooperative agreement. And so as you all move forward in looking at funding opportunities, paying special attention to what type of funding it is will have implications in terms of what kinds of data collection you will ultimately end up being required to do. So a cooperative agreement means that the funding agency has more involvement, is more collaborative in sort of the goings-on of the initiative in terms of setting up requirements and things like that. It means a lot of things, but that's one of the things that was important to me as an evaluator. So these grants are 5-year grants, and they begin with a needs assessment and a planning year, and so we'll talk a little bit about that. We're currently in our 3rd cohort, so there was 13 awarded in year 1, and I was an evaluator on 2 of those initiatives, and so I'll sprinkle in some experience from that. There were 6 awarded in the 2nd cohort and 6 in the 3rd. So grantees, there's significant data requirements in this initiative. So grantees must report to ACF on performance measures. They have agreed to conduct rigorous evaluations in their communities, and I'll talk a little bit about what that is. And they've agreed to engage in continuous quality improvement activities. So the goals for Tribal MICHV are to support the development of healthy, happy, and successful American Indian and Alaska Native youth and children and families. We do that through implementing high-quality, culturally relevant, evidence-based home visiting programs, through expanding the evidence base around home visiting interventions for Native. We want to expand what we know about home visiting in Native populations more generally. And the 4th and last goal is supporting and strengthening cooperation and coordination and program linkages among various early childhood programs, which we hope leads to comprehensive early childhood systems. Many of you will know from having worked on these initiatives that sometimes there's tons of coordination within a community, and sometimes things are working in silos, and often kind of grants can be used to foster more collaboration, and that can be one of the really nice benefits. So TEI, the Tribal Home Visiting Evaluation Institute, is a group of different entities, and what we do is we provide technical assistance for the Tribal MICV program on tracking and reporting benchmarks, so any kind of performance measurement issues. We provide technical assistance on the rigorous evaluation design and implementation. We help folks think out their data systems, and we do continuous quality improvement training and then facilitate learning communities around CQI. And then we work through ethical dissemination and knowledge translation kind of issues. So if you take all this data from all these different types of initiatives and you want to share what you've learned, how do you do that in a way that's responsive to the community that the data was collected in and makes the information really meaningful? So there's two sets of partners with TEI, and we all work collaboratively. One is the first column. You'll see the technical assistance providers. That's James Bell Associates. That's the company that I work for. And we collaborate with Johns Hopkins School of Public Health with some amazing people at the Center for American Indian Health, and then also with folks at the University of Colorado School of Public Health and the Centers for American Indian and Alaskan Native Mental Health. And then we collaborate closely with MDRC specifically around the continuous quality improvement. And this collaboration is always in conjunction with our partners with the feds and the Office of Planning, Research, and Evaluation, the Administration for Children and Families, and the Office of Child Care. So the reason why I kind of present this setup is to let you all know that we totally recognize how much support is required to ensure successful data collection, and we work really strategically across lots of different entities to make sure that support is ongoing and of really high quality. So now I want to get into the specific tribal MICV data collection activities. And I just want to kind of lead in by suggesting that we have these goals. We just presented the tribal MICV goals, and they're very lofty, amazing goals. And so one of the things that everybody who dreamed up this initiative knew was that we were going to have pretty extensive evaluation and data collection to be able to let programs know how they were progressing, to let the initiative overall kind of know what kind of effect it was having, and then also to really provide really useful information to the children and families on the ground level. The other thing I wanted to just say quickly is that for tribal MICV, the grantees are really, as they come in, they're in really different places in terms of their data collection infrastructure and expertise. So we have people coming in that are receiving these grants and having to respond to the requirements who are in really, really different places in terms of their ability at their institutions to meet those needs. And so we can talk a lot. I imagine that might be the case for the vast number of people that are on this call today. So hopefully I can help you. I'll mention some things that will be relevant to the particular place that your specific entity is at. So the first thing that I just wanted to talk about is that the requirements for any of these initiatives can be really intimidating, especially at first when you're looking at them. And that was certainly my experience as an evaluator, and the experience that I think for my collaborators and the program staff that I was working with. The other thing that happens oftentimes is that when you get your team together to start actually doing data collection planning, you're reading through the grant and you realize that there's promises that have been made in the proposal that might have been made by people who are no longer part of the program or might have been made in a really theoretical way. And so, I just want to honor the fact that I know many of you will either have or at some point will be kind of digging through some very complicated efforts, but it's worth it in the end. We'll talk about that next or at the end. Okay, so I'm going to go now over there are four primary domains of data requirements for tribal MICV. And as Dawn mentioned in her introduction, I think that many of this is more extensive than what is required typically for ANA, but this will give you an idea about what the grantees who I'm talking about were asked to do. So the first set of data collection was a needs assessment that was done during that planning year that I mentioned earlier. And the goal of the needs assessment is to understand community health and well-being. So grantees customized their needs assessment. Some did qualitative, some did quantitative. People used lots of different indicators and approached it in really different ways. The needs assessment was used for the programs to select their home visiting model. So the idea was if you established a need for support for young mothers with substance abuse, that you were able, through your needs assessment, you were able to go and select an evidence-based practice that offered care for those types of families and then had demonstrated success with those types of families. So it was meant to improve home visiting model selection. And many of the grantees, if not most of the grantees, used really delightful kind of interesting community-engaged approaches to that needs assessment. So the second round of data requirements for this initiative are performance benchmarks, and benchmarks are something that lots of people talk about and can be a little cringeworthy and can also be really exciting. So MICHE has a very significant setup in terms of the benchmark requirements. So they're meant to demonstrate performance improvement over time. They are legislatively mandated, so there's not a lot of flexibility. There's no flexibility in the benchmark domains, but I'll talk a little bit about how people use different kinds of, they operationalize each construct a little differently to customize the measures to their own community. There's no client-level data that's reported for the benchmark measures. There's 37 constructs overall, so it's really extensive. It's been a tremendous amount of work for each of these grantees and for the TA supports. And what TEI does is we help grantees to develop their benchmark plan. We help them prepare anything that they need for infrastructure or training for the successful data collection. And then we help assemble reporting to ACF and work with individuals throughout their process. So the six benchmark domains, I'm not sure if you guys all are familiar with this, but bear with me. It includes things like maternal and infant health, child injury, school readiness, coordination of services, family economic self-sufficiency, and crime and domestic violence. So those are the big domains, and then there's constructs, different numbers of constructs under each benchmark. Okay, so that's the benchmarks in a nutshell. The next data requirement in Tribal MICHE is the rigorous evaluation. And so the rigorous evaluation is where each grantee gets to answer a focused evaluation question using rigorous methods. Grantees select the question using a community engagement approach, and so we'll talk a little bit about that, what that ended up looking like for grantees, and are required to use a rigorous, what we call a rigorous design to answer the question. This part of this data requirement is the one that assesses program impact and looks generally to adaptations or implementation strategies to pick one kind of aspect of the program and really determine if it's having the desired impact. So the way TEI has provided technical assistance has been to help each grantee develop a customized evaluation question and design and establish the rigorous evaluation design using the PICO approach, which is an approach that helps to break down the population that you're seeking to affect, the intervention that you're going to do, the comparison that you're going to use, and then the outcome that you're going to attempt to reach. And then after folks get their question and their design in place, we provide TA on developing IRB protocols and then thinking through analysis plans and then dissemination. All right, you guys, I'm moving pretty quick, so if you have questions, just please feel free to use that little button. The final data requirement for tribal MICV is continuous quality improvement. And this is really has been a really exciting thing that we started over the last, I guess, year and a half. With we rolled it out with cohort 1 grantees and then cohort 2 and then cohort 3. And this is where the grantees are really able to use data to identify and test changes that directly improve their program. So grantees select CQI topics like screening rates maybe, or if they're struggling with retaining families, or they can pick one of their outcome, their benchmark domains, and say, oh, we really want to focus on breastfeeding or something like that. So they're able to identify a CQI topic and then use the benchmarks or other kind of data that they have existing or collect new data to make data-driven improvements to their program. So what TEI has done is that we've hosted a series of in-person trainings focused on the PDSA cycles. I'm sure you guys have heard this: Plan, Do, Study, Act, and which have built the capacity on the ground for folks to run through these PDSA cycles in the course of their program implementation. So one of the things we like to do once we run through all of those data requirements is to make sure that folks understand that the data is not always clearly defined or bounded in those four sort of areas. So we have lots of overlap. The needs assessment comes early on in the process, and so it's not included in this graphic, but you can see that we want to show that there's significant overlap between, the benchmarks, the continuous quality improvement data, and the rigorous evaluation data. And some grantees are able to really cross-utilize data for all of those requirements, and others find it easier or more strategic to keep the data separate. But there's important distinctions in the way that the data is actually used. So, in the local rigorous evaluation, it's used to assess impact, and you need to have a comparison. In the continuous quality improvement, we see that it's used quickly and to assess just program improvement and to test little tweaks in your implementation. And in the benchmark domains are fairly well set out and defined, and so the data is used specifically to respond to every 2 years reporting cycles. So grantees for each one of these domains, grantees make decisions about the data that they collect based on their community priorities, and they do that with a couple of different strategies that we'll talk about a little bit later, but including community advisory boards or bringing together groups that review particular measures, things like that. So there's lots of different strategies and there's lots of overlap. The other thing is that what you'll learn is that people use terms like research and evaluation really differently across all the different evaluation resources that you'll come across. And so for people who do not have a lot of experience with evaluation or research terminology, it can be a little tricky to know when people are using the same terms like evaluation to mean different things. So some people, when they hear evaluation, they're thinking more like something that when we use the term benchmark or when we describe the rigorous evaluation component, it sounds more like research to some people. And so it's just really important to feel really comfortable asking questions about what do you mean by evaluation, what do you mean by research when you're looking through documents or resources that are supporting you in your process of building your evaluation, or when you're hearing about other people's evaluation data. So next I'm just going to talk a little bit about where our grantees access data, just in a real nuts and bolts kind of way. So we have data that's coming in as self-report data from families. You can see different strategies that we use, including screenings or just counting service utilization stuff. We have grantees who have set up partnerships across to use administrative records across entities, which is really valuable both in reducing the burden of data collection for staff, but also on families. So if they've done an ASQ with their child care provider, they maybe don't need to do another one with their home visiting, or vice versa. And then we also have data that is collected by the home visitors themselves through documentation and observation. So we have program data like missed visits, things like that, very tracky kind of an orientation. But we also have things like the Piccolo or the home measure, where the home visitor is actually trained to do observational assessments of parent and child interaction. And so they're doing the data collection themselves. They're filling out the instruments themselves. And then we have process information, so like tracking referrals or tracking when families have been given information and things like that. So those are all three types of valid data collection access points. So when you're thinking, so now we've shared a little bit about the different types of data collection activities, the different types of requirements that we have, the different places that we go to collect data, and now we can think a little bit about sitting down and kind of developing and implementing our system, right, a data collection system, and we'll use, this slide uses benchmarks, the benchmark requirements as an example. So basically, you can see that this is a real iterative process, right? So it's going around in circles, and there's constant tweaking and constant feedback between lots of different stakeholders. And so, it's not something that people do all alone in their office and do perfectly. It's something that takes a lot of coordination. Grantees develop and operationalize performance measures that correspond to 37 federally mandated constructs. I think I had 27 in the other one, but so one example might be that breastfeeding is operationalized by one program as like an increase in average number of weeks, right, across time, and in another program might be operationalized as % of mothers who breastfed for at least 6 weeks. So those things, the way that it's operationalized doesn't sound like maybe a huge difference at first, but when you look, having the grantee be able to define what's going to make the most difference for their moms and for their program really ends up making a difference in terms of whether you can demonstrate an improvement. So, for instance, if you have lots of mothers who are already breastfeeding, but they're just not breastfeeding for very long, you might want to have something that assesses an extension in their breastfeeding. But if you have a situation where in your community not very many mothers initiate breastfeeding, that might be something that you want to take a closer look at. So that just gives you a little hint about how the kinds of decisions that grantees are making. So grantees select appropriate measures that correspond to community priorities. So that's what we're kind of, I want to really hit home here, is that the more kind of thought and engagement that is made at the local level, the more meaningful the data is going to be, and the more likely it is going to be used. So one of the things that, another example of it needing to be really operationalized at the local level would be one of our grantees has no emergency room services in their community. So for the construct that's around emergency services, it really has to be operationalized in a way that it does not depend on ER visits, because there's no ER. So these are just points to help drill that message home, that things need to be led by the local community. You guys are the experts. So, okay, so that's kind of an example, just running through a few different ideas for how you can operationalize your benchmark requirements, or how tribal Michigan grantees have operationalized their benchmark requirements. Any questions? We're going to move on to rigorous evaluation. Let's see, no hands. Okay. So, if we move into the rigorous evaluation, it gives us an opportunity to think about what the difference is between benchmarks and the rigorous evaluation, and that the rigorous evaluation actually integrates a comparison group, so that you can know in really, really simple terms, so that you can, depending on how the design gets structured, it's really so that the programs can know if they've had an impact that's been more than they would have had with no services, or if you can compare two types of services. So they can look in their program and see if families who receive extra language support have a different kind of effect than families who do not receive that same kind of involvement, or like a cultural parenting curriculum, if families who participate or who don't, you can compare those two groups. We've also had, because we want to attend to both cultural rigor and scientific rigor, we have been very flexible about design so that people can use different ways of comparing, including in-person comparisons, which means that instead of comparing one group of people to another group of people, you're making comparisons of the individual over time. But it would take a long time to kind of cover all that, but I just wanted to introduce it. So the grantees in the rigorous evaluation each developed an evaluation question that was important to the community. So these rigorous evaluation questions emerged from the community. There was a set of requirements about that they maintain certain types of rigor, but there was no requirements about topic made. The grantees select an evaluation design that is both rigorous and acceptable to the community. Grantees were encouraged to narrow the focus of the evaluation. So they were encouraged to measure small sets of outcomes instead of trying to see what the program impact was. For instance, they were looking at really kind of just particular aspects of their program. They were asked, or there were suggestions about examining components of HV programs, so looking at one particular maybe module in your home visiting services and really drilling down to see if that was necessary or added any kind of improvements or that sort of thing. Or many of the grantees actually ended up focusing on their implementation strategy. So like, is there certain kinds of recruitment efforts that work better than others? Are there certain retention strategies that keep families really engaged in home visiting? And then some programs evaluated enhancements or adaptations of their EBPs. So one of the things that our community-engaged approach does is that it helps us to ensure that we're going to get results that are more likely to have be meaningful and be translated into practice. And so that's why we have we hold up the insistence on cultural rigor. By cultural rigor, that might include engagement from the entire community in the evaluation process. It might mean that we are that we've gone to certain kinds of, some groups made sure that they checked in with different types of stakeholders to make sure that from different perspectives within the community that the methodology was culturally appropriate, that the question was meaningful at the local level. All these things are really highly valued. So when I say evaluations are tailored to the community and to the cultural context, we mean, tailored like a custom suit, not set up and then altered. These evaluation programs, the methodologies used, the measures, the design were really emerged from the community. So the federal guidance was written to allow for individualized as opposed to prescriptive approaches. There was an inherent respect for tribal sovereignty and diversity of the communities. So there was no kind of custom, there was no sort of fits-all kind of designs shared. There was lots of flexibility to define the evaluation questions, and it's led to these incredible innovative kind of approaches for looking at cultural enhancements to home visiting models, which we're hoping will really contribute to the knowledge base. And there was lots of flexibility to find performance measures, and this ultimately ended up really helping the benchmark data to, function to reflect the community context as well. So we were excited to have that openness at the federal requirement level. So basically the general approach to evaluation within Treble MICV is that that knowledge will be generated at the local evaluation. So there was no cross-site evaluation done. And in some ways that sounded, I think I can be honest in saying that at first that sounded really, really exciting for me as an evaluator. Then it sounded really, really terrifying. And then it sounded maybe undoable for a few days. And then at the end, it's been completely valuable and exciting again. So it's a little bit like a washing machine, but it's worth it. So evaluation questions are developed by grantees in consultation with their community to reflect local interests, fundamental to our approach. Evaluation questions are informed by findings of the needs assessment. So the idea that data builds on data, we don't just collect data and then report it and then file it away and never use it again. We use the data that we collect across time. And the fundamental to our approach is that there's tribal ownership of the evaluation process, the data, and dissemination at all levels. So we require IRB and tribal approval for programs to move forward. So evaluations can be really limited in size and scope, so they can be very, very small and focused to be able to optimize the meaningfulness of the data that they produce. So they don't need to be these huge kind of studies. And we believe that evaluations will inform grantees and communities, and then the field more generally as we continue to implement home visiting, specifically in tribal communities, but I really think beyond. There are lessons that that home visiting in general will learn from tribal communities that are invaluable. We're seeing that more and more. And the final thing is that we understand that intensive technical assistance is provided to increase tribal capacity and empowerment, and that we're enthusiastic to be able to provide that. The other thing that I just wanted to say before I move on to this next section is that the tribal MICV grantees do not have large budgets, and so evaluation budgets. And so what we do is we encourage grantees to look at, at these kind of smaller things that they can bite off, and really focus in on things that are meaningful to them. So it's so we are, even if you can imagine I'm presenting all this data collection, we are doing them without huge kind of budget. So people are being very savvy and practical. All right. So now what I would like to do is move on to the final kind of section and talk about the lessons learned from tribal MICV grantees. And so I think one of the things that we acknowledge as technical assistance providers is that evaluation is often regarded as a requirement rather than a tool for many local communities, right? And so one of the things we wanted to do after 2 years of cohort 1 having been through this process of developing their evaluation plan and then collecting data, excuse me, we wanted to go back to these evaluators and program staff and say, hey, what was of use, what was difficult, what was challenging, what didn't make sense, and get their expertise about how to set this system up. So what we did was we sent out a list of questions and gave grantees a few weeks to work with their teams to come up with responses. And so what I'm going to share with you here are responses taken from that effort. So one of the things that we really feel profoundly about is that it's critical to shift from evaluation as judgment to evaluation as learning perspective, right? So if folks feel like they're conducting data collection and evaluation activities just to prove that they are doing good, doing work or something like that, that it's much less engaging than thinking about conducting evaluation and data collection activities as a learning process for all of us. We learn from the grantees learn about their own programs, supervisors learn from their home visiting staff. So we just want to optimize the use of data and learning across all these different domains. Because ultimately, at the end of the day, what our shared goal is to find better ways to serve tribal children and families. So that's the driving force. So what we heard from the grantees is that in hindsight, in retrospect, data planning often ended up really supporting community program planning and implementation. So grantees actually ended up being able to use those data requirements to advance community-wide discussions about overall data needs. So for instance, the home visiting program would say, okay, well, we have to collect ASQs on this kind of system based on our requirements, and then there would be a conversation with, an early Head Start program, and they'd say, oh, wait, we have to do that too. We have some of the same kids. Let's try to share our ASQs. And then, another program that doesn't require ASQs would say, well, hey, you guys are getting such great data about, child development. Like, maybe we can implement that. So there was lots of shared coordination and planning, which was really exciting. So grantees also explained that they were able to, that having to go through something like the benchmark requirements meant that they were able to take these theoretical things that come up in proposals, right, where we've said, well, we're going to measure this and we're going to measure that, but it made folks kind of get down to the concrete, to the day-to-day, the nitty-gritty, and that ended up helping make decisions about when home visits should happen, when modules should start, how people should be kind of engaged during their enrollment. It helped lay out the kind of protocol for the whole program implementation, not just the data collection. So that was two retrospective benefits. And one of the things we heard over and over from the grantees in their response to our inquiry was that locally defined data meant that the data ultimately was more meaningful, that the data plans ended up being more feasible, and that at the end of the day they built capacity in the community in a really fundamental and effective way. So, one grantee, as you see in this quote, mentions that being able to tailor the measures to the community increased the accuracy. So they knew that folks would be able to answer the questions the way that they were phrased. Folks would not be insulted by certain kinds of questions and decline to participate in the data collection. We were able to kind of avoid things like that by tailoring the data collection. And this was perceived by this program as, they mentioned this is an important way in which the individuality of each tribe and program was honored. So that was a valuable aspect of the way we approach data collection. One of the things that we've heard time and again and that I experienced myself in the first two, in the programs that I worked with, is that there was a real concerted effort to be thoughtful about balancing service provision and data collection needs. So nobody, including all the researchers on this program that support this program, wanted data collection to negatively affect home visiting service provision. So having it managed at the local level, having people who are on the ground and understand the day-to-day aspects of the program, they were the best people to be able to determine what was too much data, what was enough, how often we should be conducting data collection, how long data collection visits should go, all these little really important kind of decisions that need to be made. So you'll see that this person, this group mentioned that they were able to stay away from lengthy or unwieldy tools, even if they were validated or considered reliable. So for this particular community, burden on the family in terms of filling out the data was something that they needed to value as they considered tools just as much as the tools' validation or reliability. And then finally, as I mentioned, the planning process for data collection and then actually the training, the skill building, and the supervision around data collection allowed for capacity building at the program level, and which is super exciting to me. So you can see in this quote, the process allowed team members to expand their personal skills and the organization overall to build capacity in research and development for times to come. So they now can have more experience in developing evaluation plans, logic models, things that they'll need to do for proposals, but they also have really individualized skill building happening. I mean, one of the most exciting program things that I've experienced is one of the home visitors who I worked with early on is now a local evaluator and thinking about pursuing graduate education as a result of having been part of these conversations about data collection. And so, sky's the limit. So there's been extensive capacity building, which is really great. The other thing that I've mentioned many, many times throughout this presentation, and now we'll kind of focus a little bit on, is the fact that engaging community members in data collection, planning, and implementation is completely key, and folks have come up with some creative ways to do that. So one way to do it was to really administer a successful needs assessment in the community and then draw on that really purposefully for program planning and data collection. So not just doing that needs assessment and then tucking it away in the file cabinet, as I mentioned before, but actually using it to pick the right home visiting model, to determine which benchmarks are going to be really important, and maybe even to think about using that needs assessment to start the conversation about what rigorous evaluation plan you wanted to implement. The second example is something that many of us are really familiar with, which is the important utilization of community advisory groups. So bringing community advisory groups together and having them kind of contribute in a way that's comfortable for them into the data planning. So this group says, we went through each question with the council, discussing order of the questions, purpose, wording, rephrasing, and what data the council wanted us to collect. Now, any evaluator on the phone right now would probably, love any opportunity to have a community advisory board go through your instruments with this kind of clarity, but you will also understand how much work that takes. And so, sometimes you have a really high-functioning community advisory board that's very engaged with research measures, and other times you have community advisory boards who you're really dragging to the table to even think about data collection. And so it requires a certain amount of flexibility on our parts as evaluators and program staff. And so the last thing, the previous example is also an example of this, but one of the things that I think is really important is that grantees talked about the importance of engaging community members in the review of potential measures. So if you are, if you're to do a search of all the different types of measures for your individual program, you're going to find lots of, or maybe you will, but some science on which measures are valid, which measures are accurate, but it really takes local folks to understand which measures are going to fit in with the kind of language of your community, with the cultural norms of your community, with the context. And so it's a real important utilization of community members, I think. And finally, data is no good unless you use it. And so we asked folks, like, how are you using the data that you're collecting beyond reporting, right? And grantees mentioned that they use their benchmark data for program monitoring and improvement. So this first program mentioned that they meet monthly and discuss the data in their meeting to talk about what kind of ideas they have for making changes in their program or celebrating things where they're having a really nice, they're being able to demonstrate improvement. Grantees are beginning to translate data for use with tribal government. So they're with partner organizations and community groups, so they're able to take this data and go and present it back to the tribal government in a way that makes folks understand in the community how important these programs are and maybe can help think strategically about how to make them more sustainable or to get more community buy-in or how to extend the reach of the program. So the data is being used in a really practical and creative way to at the program level as well as just to meet kind of data reporting requirements. So, I mean, as you guys can tell, the whole point of my webinar is basically to talk about the facts, to convince you that high-quality data is local data, and that it's a lot of work, but it's worth it. And so, when we went and talked to grantees about their data collection, they talked about the need to have them be culturally relevant, and that one of the things that really benefited folks was being able to talk to the previous cohorts about what kinds of tools that they had used effectively or ineffectively, trying to access articles and using lit searches about these measures to make sure that you've got the right ones. TEI created a compendium of measures so that folks would at least have a big list of things to look at. So these are strategies that make it easier to have your locally to have your evaluation be locally tailored. And finally, I just wanted to this is just a nod to what I've already mentioned, but we know it's a lot of work, and that very often data collection requirements feel like just that, like requirements. But at the end of the day, as this grantee has mentioned, that with the right technical assistance and the right support, many programs at the end feel like even though it would have been quicker to have electronic templates or cross-site evaluation plans, that for the individuals in the program involved, it wouldn't have resulted in as much learning. So here we have, at TEI, we've developed a lot of resources to help program staff who are responsible for evaluation activities and to support local evaluators, really running, and all the way to, running the gamut. But I wanted to just quickly give you guys a few really good kind of quick, easily accessible resources as you're pursuing your evaluation activities. The first one is the Program Manager's Guide to Evaluation by ACF. It'll be a very nice introduction to the different aspects of evaluation that program managers can think of. It explains what program evaluation is, why evaluation is important, and how to conduct an evaluation and understand your results. The Indigenous Evaluation Framework, the second one, talks much more about traditional ways of knowing and identifies 4 core cultural values that influence approaches to evaluation in Indigenous communities specifically, including creating the story, building the scaffolding, planning, implementing and celebrating, engaging communities, and building capacity. So you guys can check that out if it's of interest to you. And finally, I included the Kellogg Foundation. The handbook, the evaluation handbook from Kellogg, is really focused on doing ongoing evaluations for the Kellogg Foundation, but really it's very useful as a framework for thinking about evaluation as a relevant and useful program tool, not just something that contributes to research or helps you meet your requirements. So finally, just some takeaways from the Tribal Michvi grantee experience and technical assistance experience. We've learned that strong partnerships facilitate the ability to have strong data. So you can't just have the best data collection plan and go out and do it yourself. You need lots of partnerships to make sure that it'll work. Accessing and collecting helpful data relies on an understanding of the program processes, so the local knowledge about how the program actually works, what the community needs are, what the current infrastructure is to support those data collection activities, and also really solid understanding about what the requirements are and aren't. Because one of the things that I will say is that many times when you're reading through federal requirements, one direction is to create data collection plans that don't meet the requirements, right? But many times what ends up happening is that people end up doing much harder data collection than they actually are required to do. So it really it behooves you to take a close look at the requirements and really understand them and ask any questions that you need to be able to get to that understanding. So accessing and collecting data can be challenging. We know it, that sometimes we're walking into contexts of unfamiliarity with data, even mistrust of data collection or data in general, research in general. So we have to really understand those and understand where people are coming from and then create ways to alleviate that mistrust or improve knowledge of data collection and purpose. We have to always be really cognizant on the burden of staff and families, as I've talked about. That's something that our programs have really learned, that you can't just ignore that it's burdensome, but you also, so you have to honor the fact that you are taking people's time, but that it's worth it. And that it requires sometimes some pretty costly investment of technology and expertise. So it's a lot of time and energy that goes into data collection. But having access to useful, accurate data can be tremendously beneficial for program improvement, for improved collaboration, and for sustainability for your program.
Let's thank Melina for joining us. I know she has some pretty intense experience with evaluation, and some of our communities are, starting from the very beginning. But I hope we all can appreciate what data collection and evaluations can do for our communities. Again, thank you, Melina, for joining us, and thank everybody for participating. And again, if you can still download the PowerPoint, that will give you all her resource information. All right. Thank you, everybody.
Thank you, everyone.